Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, July 18th. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. I hope you're all doing well. I hope you're staying cool or as cool as possible. If you're here in the New England area, it has been incredibly hot and humid. Even though it is July, it's still a little bit unbearable, especially when you need to have a shirt and tie on like I'm dressed. But who's complaining? It's summer. It's supposed to be like this, but I hope you're all doing well. Let me jump into the news of the week. As we indicated in last week's message, our focus this week is on healthcare. For those of you who have been Mass Retirees members for a number of years or following along, you know that for the better part of the past 2+ years, we have been consistently sounding the alarm, banging the drum, use whatever analogy you want to use, but letting everyone know of our concerns and the concerns of our members over the growing cost of healthcare and the growing concern about healthcare affordability. Now, this isn't just us saying this, and it's just not our concern. These concerns really are nationwide, but particularly here in the Northeast, where healthcare costs tend to be higher than most of the rest of the country. We have some of the best doctors and hospitals and healthcare networks anywhere on earth here in Massachusetts and Boston and New England, but that comes with a high cost. And part of that high cost is just medical inflation, but it's also the very high cost of prescription drugs. And you've seen a lot of reports about this in the news, in our reporting, as well as in the general media, and others about GLP-1s, the weight loss medications and diabetic medications and so forth, which is just the latest example of a particular medication or a particular type of medication that is really driving some of these costs higher and higher and higher. Now, over the past few years, Blue Cross and Blue Shield has been very clear on their concerns. WellPoint, the Group Insurance Commission, local city and town health plans, whether it's the Mayflower Group down on the South Shore, the Maya health group that's run through the Mass Municipal Association. Just this week, I had a meeting with the state of New Hampshire health plan that represents all of the municipal retirees and employees, as well as school department retirees up in New Hampshire. They have the exact same concerns, and the conversation was very much on these exact issues. Everyone's facing the same problems. Now, compounding this concern is the fact that recent cuts in federal spending, and those cuts are coming. We know this for a fact, and the state officials here in Massachusetts and around the country are still trying to grapple with exactly what that looks like and what that means. On both the public sector side as well as the private sector. We know that there have been significant cuts to healthcare spending in general. A lot of those cuts directly impact our hospital systems, whether it's through research or direct care of patients. But all of these things together really create what can only be called a perfect storm of events that are going to further complicate and compound these problems and really are leading to even bigger concerns. Now, under the Medicaid system, we know that over the next few years, Massachusetts alone is facing billions of dollars in cuts. Now, when you think of Medicaid, you immediately think of MassHealth and the MassHealth Care Connector, health insurance programs and so forth. But the Medicaid program goes much further, much deeper than that. Medicaid also pays for nursing home and home care services for older adults and the disabled. These types of cuts coming are not only going to hurt healthcare plans, but they're also going to hurt the ability to provide long-term care services for older adults and the disabled, whether it's through direct payments, whether it's through cuts in operational cuts or staffing shortages that these facilities may face. These are all the concerns, not just of us, not just of the state government, but of these private entities as well. Now, we've been very fortunate over the past few years, and we've been talking about this a lot in the newsletter and at our meetings and in these weekly messages, that for the most part, the costs under the plans that are offered through the state's Group Insurance Commission, as well as at the local level, for the better part of the past decade or more, have been very stable. Now, yes, we've seen monthly premiums go up. We've seen copayments and deductibles go up. But the GIC is a good example of that stability. Over the past 7 years, plan design has been very stable. Copayments and deductibles have not increased at all over the past 7 years. Once again, we want to compliment and commend the GIC Executive Director Matt Vino, his staff, the 17-member GIC Commission, for making the decision not to balance the books on your back, not to cost shift, not to dumb down the quality of the plans. They've done a tremendous job managing all of this. But at the same time, we know that over the past 2 or 3 years, your monthly insurance premiums have risen considerably. Now, as we say in today's email message to all of you, as well as in our social media messages, that if you doubt any of these factors are true, that there is a healthcare affordability crisis upon us, you need look no further than the monthly premiums that you're paying for your health insurance. They've undoubtedly gone up. Now, the amount they have gone up really vary from plan to plan, depending on where you're retired from, depending on whether or not you're on a Medicare plan versus a non-Medicare plan. Thankfully, retirees who are insured through a Medicare plan have a lot of protection in terms of higher costs. The reason for that is that the federal government is providing for the majority of the funding for your Medicare plan, both Part A, which is free if you paid in and you earned it, and the Medicare Part B premium that would be withheld from your monthly Social Security check, which is about $185 a month, give or take at this present time, in addition to the money that's coming out of your pension check to pay for your supplemental insurance coverage, either through the GIC or the city or town that you retired from. We're very fortunate that the combination of these benefits have been and still are excellent. They're high quality, affordable health plans, and we do not want to see that change. We don't want to see a race to the bottom where bare bones plans are all that's affordable. Now, as I said a moment ago, the GIC has done a great job of holding the line on cost increases and not passing those costs on to all of you, other than through the higher premiums, which you're then paying a portion of. The Commonwealth is picking up the lion's share of that. Our fear is that we're kind of reaching the end of our rope in terms of what the Commonwealth and cities and towns can afford to pay. We don't know if we're there yet. There are no plans right now to make any significant changes to your healthcare coverage, either at the state or local level. I don't want to panic anybody, but at the same time, we want to make sure that all of you are aware of our concerns, that you're aware of what's going on, and at the same time that you can continue to serve as our eyes and ears on the ground in the cities and towns that you live in. Our biggest vulnerability historically has been at the municipal level, through the communities that are offering either their own health insurance coverage to their retirees and employees, or who have chosen to participate in what we call a JPA, a joint purchasing agreement, where various communities band together to purchase health insurance on a collective basis. Doing so tends to provide better coverage at a lower cost than if they're operating on their own. Now, the difference is larger communities, like the city of Boston, for instance, are extremely large. They're very capable of managing and providing their own health insurance benefits. Other cities, large towns are also able to function independently without incurring additional costs. But the smaller communities, by and large, choose to band together. And as we reported in the July Voice on the Mayflower Group, that again operates down on the South Shore, it is headed up by Plymouth County Treasurer Tom O'Brien. Tom and his staff, Sheila Avery, for instance, runs the plan. They do a fantastic job. The Maya Healthcare Trust does a fantastic job. The Cape Cod Municipal Health Group. There are many others across Massachusetts, from here in Eastern Mass all the way out to Berkshire County, who are doing a fantastic job. But the challenges that these plans face are only getting more and more severe. Now, one of the things we have been trying to accomplish by ringing the bell on these issues and in expressing our concerns is we don't want to wait until it's too late. We've been down that road before. 15 or so years ago, we were facing similar challenges in terms of healthcare affordability. Back then, the easy way out for many communities, as well as at the state level, was to simply increase costs on you, to cost shift. Charge more for a lesser quality product. We've fought those battles in the past. We've been in the trenches with our friends in labor. We do not want to go down that road again if we don't have to. But what that's going to take is everyone coming together collectively to figure out a path forward, to find a new way of doing things. Some of those new ways might be coming up with innovative ways to gain control over costs, to help people lead a healthier life. The IBIS telehealth program that we've been promoting now for several years is one great example of that. And we are seeing very positive signs, as a matter of fact, through that program, that it is being successful in improving the quality of life of the retirees who have enrolled in the program, as well as over the long run, lowering costs by helping to keep retirees out of the hospital, out of the emergency room, and being healthier at home is really what the cornerstone of some of these programs are all about. And we're going to continue to seek out partners and profile different ways in which you can participate in these programs that collectively are really designed to help lower healthcare costs. Now, just yesterday, on Thursday, the Boston Globe editorialized on this very issue, healthcare affordability, talking about the cuts coming from Washington, coupled with the challenges here at the local level in Massachusetts. And at the end of the day, their call to action was very much in line with what we have been saying for the past several years. And that is, again, that we need to come together. The stakeholder groups representing retirees and employees from both the public as well as the private sector, the insurance companies, the doctors, the hospitals, the pharmaceutical industry. We need to find a way to improve this entire system before it's too late, before it becomes so unaffordable that folks are choosing not to go to the doctor, not to take a prescription, not to get the health care that you need in order to live. And in doing those things, at the end of the day, it only increases the costs on the system. If you get sicker, if you end up in the hospital, if you end up needing to take an ambulance somewhere, that's far more expensive than getting to the root of these causes in the first place. But it's going to require us all coming together. Now, we're very encouraged that, and this is no surprise, that our friends in labor at the AFL-CIO just last week convened a roundtable of sorts of both public sector and private sector unions. Now, while Mass Retirees is not a union, we're not affiliated with the AFL, we are a private, nonprofit association representing retired public employees here in Massachusetts. That's our sole focus, that's our mission, that's our only agenda, is representing all of you. Now, despite that, we have had a very close working relationship, friendship with the AFL-CIO, with our friends in labor in both the public sector as well as the private sector unions, going all the way back to our founding in 1968. We have always worked hand in hand on retirement issues, on healthcare issues, really of anything that's of common concern with our brothers and sisters in labor. And on this issue, it's no different. And we are very thankful to Massachusetts AFL-CIO President Chrissy Lynch, who's been a dear friend of ours for a number of years. Chrissy is now leading the Massachusetts AFL-CIO. Just like her predecessors, she invited Mass Retirees to have a seat at the table for this roundtable. Nancy McGovern and I had the pleasure of presenting to the larger group on the details of our public sector healthcare plans here in Massachusetts, both the GIC as well as our municipal plans. So Chapter 32A, which governs the GIC plans, and Chapter 32B, which governs municipal health insurance. Now, we were joined by our colleague Andrew Powell from the Massachusetts AFT, who's a healthcare expert in his own right, talking about the larger issues and the cost drivers and kind of why we're in the situation we're in right now in terms of healthcare affordability. The building trades, the bricklayers, made an excellent presentation on the challenges facing the private sector union plans under the building trades. And some of their challenges are even greater than the ones that we face over here in the public sector. But at the end of the day, the common ground was clear. We're all facing the exact same problem that we need to work together on a solution, and that's exactly what we're going to continue to do. Now, the AFL is going to stay very engaged in this issue. Our understanding is that as we're developing ideas of how we can work together, that will eventually become part of the official platform that is likely to be presented to the full body of the AFL-CIO at their conference this coming October. But it was a huge step in the right direction, and we're going to continue to work together on these issues because, again, we know what's coming. And if we just sit back and do nothing, we're all going to pay a very significant price for that. But this is going to continue to be a major focus of our association, along with the COLA Commission, our legislative package, which is working its way through the legislative process. There's always a lot going on, but healthcare is a very top concern. It's something that we work on day in and day out, and we're going to continue to report back to all of you. But in the meantime, again, I cannot emphasize this enough. If you learn of something going on in your local community here in Massachusetts or wherever you retired from here in Massachusetts, in terms of changing health insurance benefits or increasing health insurance costs or anything regarding the local municipal health insurance plans, pick up the phone, give us a call, shoot me a text message, send an email, send a carrier pigeon, do whatever you need to do. Let us know what you're hearing. Oftentimes, we may already know about it, but there's always a chance that we haven't. There's always going to be a first of how we learn of things, and it's usually by one of our members picking up the phone, giving one of us a call and saying, hey, X, Y, or Z town, I just got wind at the coffee shop this morning that the town manager is thinking about making some changes, or the mayor is talking about making some changes. If we learn about it early on in the process, we can organize our local retirees, we can get out in front on these issues, and 9 out of 10 times, we've been able to prevent the worst case scenarios from happening. And it's going to take all of us working together to make sure that all of you continue to have the best quality, most affordable health care that's available anywhere on the planet. And that's our main goal in terms of healthcare going forward. So with that, let me sign off for today. Thank you again for tuning in. If you're not a member of our association and you are a public retiree from here in Massachusetts, please consider joining. We are able to do the work that we do on your behalf because of our membership. It's as simple as that. So please consider joining. If you're an active employee nearing retirement age, consider becoming an associate member of our association. It keeps you well informed. It buys you a subscription to our newsletter. That way you're not going to miss out on anything, and you can better plan for your eventual retirement. Thank you again for tuning in, everybody. We'll talk to you again next week. Bye-bye.